Hello viewers, today we will talk with Sheila about some things that might occur after weight loss surgery. So Sheila, what advice do you have?
Yes, so after weight loss surgery, you will experience some things like change in your taste buds, portion size gets smaller, more energy from the weight loss, ability to function more in daily activities, losing weight and reaching your goal weight, getting off or taking less blood pressure or diabetes medications, and maybe experience some weight gain as well along the way. But before you get there, you may also experience some vomiting, clogging, constipation, gas, or problem with some food tolerance. Just know that these are very common after surgery and that you are not the only one to experience all the symptoms after surgery. To avoid vomiting and clogging, definitely you want to practice the basics, which is chewing your food 15-20 times per bite, and maybe keeping a food journal so that you know which kind of food is not tolerated really well. If you have vomiting, you need to call your surgeon. Clogging, also associated with food blockage. This can happen when you have not chewed your food enough times or when you swallow big chunks of food. So the food can get stuck. To practice, to eliminate this, you need to practice mindful eating and not to drink with meals. Constipation after bariatric surgery is also very common. Just be mindful on, getting enough water throughout your day, which is 64 ounces, and do your exercises and maybe include some fiber in your diet. Patients can try to add fiber in their diet, like Metamucil. It has kind of like about 3 grams per packet, or a quarter of a cup of vegetables 2 times per day, average about 4 grams on each serving. Gas problem is another thing. If you have gas pain, you need to avoid things that cause gas, such as broccoli, cauliflower, cabbage, beans, and things like that. Definitely no carbonated beverages. Don't use straw and chewing gum. If you continue to have problem with gas, you need to consult with surgeon as far as recommendation on medication. Problem foods, there are some things that you're not going to be able to tolerate in the earlier stage. Tougher meats such as beef or hamburger, membranes of orange and grapefruit, skins and seeds of some fruits and vegetables, and some fibrous vegetables. When you are having intolerance, you need to wait for several, maybe a couple of days or a week or so before trying it again. But we already know for sure some items are more difficult to tolerate. For example, fresh bread, it kind of expands in your stomach, and pasta and rice, fried foods, and different kinds of skin on hot dogs and things like that.
What advice do you have for patients who have gained some weight?
For weight gain, you definitely need to go back to basics and watching for everything that you are eating, especially carbohydrate food source, some carbs. Maybe go with the leaner method of cooking, lean and grill or bake stuff. They are definitely lower in fat and calories compared to fried foods. There are other things that you can definitely go back to your dietitian for advice. Therefore, follow-up meetings are very important with your doctor and overall.
Perfect. Okay, thank you so much, Sheila, for talking with us today.
You're welcome.